And welcome back to the Business Spotlight. I'm Pat Dewar. We're talking with Dr. Spencer Shanley, the chiropractor in the Keller area in the Texas region. One of the things that we're really thankful for is, we've been talking about how he's helping people get rid of things like migraine headaches, lower back pain, and even changing and helping someone that's afflicted with scoliosis, which is curvature of the spine. They use a certain brace that has had some great results, and even if you go back into the previous section of today's show, you'll hear the story of a young boy that was affected tremendously very quickly. Within a month, he was having some great results. Just a great result that we've been able to see. So, Dr. Shanley, how would someone get a hold of you and connect with you?
The best way possible is most likely the internet. So Googling Shanley Family Chiropractic or going to our website at shanleyfamilychiro.com.
Okay, they'll put that up on the screen. So,
okay.
And then also you've got a good Facebook presence as well. So like you on Facebook, right?
That's correct. You just look underneath facebook.com/Shanley Family Chiropractic.
Excellent. And then they can get your updates and things of that nature. I also know that we've talked about giving you a call. And if they give you a call, they want to set an appointment. And what's the usual process? How do you engage somebody?
If you call, we try to get you in the same day because we know that you've probably been waiting at least a few days or possibly months to come in. So we would like to try to get you in as soon as possible.
Yeah, because a lot of times people are hurting when they're calling, right?
Exactly, and that's the majority of people. The best time to come in is when you're not hurting. Just like when you're going to the dentist, you don't wait till your teeth are hurting or falling out. You don't wait till your back is out before you come to see me. You prevent the problem, and prevention is the key.
Yeah, but I know that, realistically, sure. People, they throw their back out and they're like, how do I fix this?
Yeah.
And so, they come in, you usually go through a process, right? When you're bringing on a client, if they, and whether you receive insurance and stuff, do you guys take insurance?
We take all insurances.
Okay.
The only one that we currently aren't taking is TRICARE, but we do have discounted rates for the military. We do respect the military, police, and fire department very much so, and actually provide that offer of discounted rates for them.
Yeah, and they're reasonable too. One of the things that I really appreciate about you is that your rates aren't so expensive that I couldn't afford you. They were reasonable. We could get together and create some solutions for my wife because I know she had some things, and me. I've had some curvature of my neck and
right.
and probably from driving too much or not having good enough posture.
Yes.
But if you were to sit there and say, give a couple of tips of what people can begin to do to maybe prep themselves to go in or stay away from you. Goodness gracious, that may sound funny, but what can people do to help their spine?
Well, the first thing is our posture, and that's what I specialize in as a chiropractor. And I have additional education on top of that as a chiropractic biophysics physician of chiropractic is restoring curves and changing your posture. And it's more detrimental than we realize, but today, our children are suffering, a lot of adults are suffering, and it's an epidemic that's going throughout our world and our nation as we have people looking down at laptops and iPads and cell phones. It's causing degeneration, premature arthritis, and collapsing of the cervical spine, leading to headaches, neck pain, upper back pain that is preventable. So this is the key, is number one is changing your posture. When you're looking down at a cell phone, don't look down like this, bring it up. Bring it up to your eye level, a laptop. Bring it up on top of a desk. Put a box or a frame of some sort underneath your computer screen to raise it eye level. Don't slouch. When you're watching television, sit up straight, keep your chest out and shoulders back with your head eye level with the television. If your TV is down low, try to raise that up also.
Excellent. Those are great tips. Sometimes it's just that little bit of raise your phone up here. I noticed myself on the plane the other day, and I had to raise it up like this because it's so easy to have it down like that. So the fact is that if they're in the Texas region and they have a scoliosis issue, they should be calling you.
They should. There should be. We should be on their speed dial. We should be the first one that they think of because we are the #1 option for natural health care. We are the only option in the Dallas-Fort Worth area for 250 miles.
Wow.
I'm the only doctor certified to have this brace. And you need to try this first. You wouldn't want to jump into any other things that may end up possibly being necessary in the future. You want to try the brace first. If that doesn't work, then you move on to surgery. And surgery is sometimes necessary, and it's great. I'm all for these doctors that are changing lives with surgery. But if we can sometimes prevent that, I have a spinal surgeon that works just down the street from my office. They referred me a client. That 14-year-old boy was referred by a spinal surgeon because he knew there might be a possibility that we could correct it without surgery.
Excellent.
And he took money out of his own pocket to help a young boy. That's what I want to do. I do all that I can to help my patients, and I want to help yours. I want to help your children. If you're having scoliosis and you're dealing with it for years and you have not had an option, now you do.
That's excellent. And then also, some of the other things that you typically see is lower back pain,
Right.
And headaches, but you said migraines. Somebody that has had migraines, that's something that has, is usually due to some sort of back.
It's usually the neck, the upper neck out of place. The forward head posture greatly strains the spinal cord, leading to irritation to the brain. It can decrease signals from the brain to the body, allowing irritation and inflammation of the spine. The other thing is the upper neck affecting the jaw. Like I discussed when I was younger, I had jaw problems. So we addressed TMJ. I have a patient with 20 years of pain. One adjustment, the jaw was now pain-free.
That's awesome. Well, folks, this is a Business Spotlight. I'm Pat Dewar. I've had Dr. Spencer Shanley. Thank you so much. He's a chiropractor in the Keller area that you need to visit. You can call him. Information was on the screen today. We'll talk to you next time.